The United States Center for Disease Control and partners have unveiled a toolkit for the implementation of a project tagged Baby Showers in Congregational Settings in Lagos. The project's unveiling, hosted by the Center for Integrated Health Programs, CIHP, aims at preventing mother-to-child transmission of HIV. It was spearheaded by the National AIDS and STI Control Program, NASCP, Federal Ministry of Health and Social Welfare, and the United States Center for Disease Control and Prevention, CDC Nigeria. In a welcome address, Dr. Timothy Efuntoye, representative of CDC Nigeria, expressed the need for collaboration among concerned stakeholders to achieve the success of the project's implementation at the grassroots level.
Nigeria, for the first time, was invited to UN General Assembly to make presentation about this innovative idea. And this was well accepted by the globe, and people started visiting Nigeria to learn how to implement baby shower. But there was a need, and to standardize the practice of implementation of baby shower. And that's what birthed the toolkit, so that we help people to be able to start the implementation, sustain it, and maybe own it in a different part of the community. And the toolkit was also developed to allow it to be adaptable so that it can be used, because CIHP have done that very well in Lagos, where they have adapted those tools to implement baby shower in the Muslim community, even in non-religious congregations. Was a huge success. So the CDC involvement are also monitoring, promoting the baby shower initiative, and also teaching and mentoring other countries to be able to take the role. So that is the CDC involvement in the baby shower group, and we will continue to be involved as we create a living environment for sustainability.
HIV is still very much around in Nigeria. We've done the biggest survey in 2018 that clearly shows that about 1.5% of Nigerians are living with HIV. Most of these are more female than male, slightly. And we've done what we call ART search, where we rapidly look for people who are living with HIV, place them on antiretroviral therapy that helps to keep them alive. And we've achieved a very great success with that. Currently, as reported by Global Alliance to End AIDS among pediatrics, in 2022 reported that amongst adults we have a coverage of 96%. But where we have setback is essentially from women and pediatrics. So in women, our coverage is at 34%. So that's why we're more concerned now than never. And then the transmission to children can happen, or good enough it can be prevented. So that's why we want to do that for that innocent child for acquiring HIV.
This is an innovation where you're taking the care to the pregnant women, and they come in that congregational setting led by their religious leaders, whether it's a priest, whether it's an imam, whether it's an alpha within the mosque setting, to really help them to congregate. In that congregation, they will get them tested for HIV, get them tested for hepatitis B, get them tested for syphilis, know their sickle cell status, be able to know if they have malaria, because you also know that malaria in pregnancy is very dangerous, and also be able to get their partners also tested. If they are HIV positive, they are then referred and linked into service where they will be able to get antiretroviral drugs. As you know, antiretroviral drugs actually help mothers prevent transmission of HIV infection to the unborn babies. Number one, that means that every baby that would otherwise have been born positive if the mother had not been treated would have a very high chance of coming out negative. Now the mother would also get treated for her own disease, so she also would have a longer life, higher quality of life, to look after that child and any other unborn child or children that she plans for the future.
Dr. Adebobola Bashorun, National Coordinator, NASCP, represented by Dr. Hafsat Inyonda, said that the toolkits were designed to empower mothers with the knowledge and tools needed to nurture their children.
The Lagos State government remains resolute in its commitment to achieve epidemic control of HIV, placing particular emphasis on PMCCC. We recognize the indispensable role played by faith-based organizations in our community and their unique ability to disseminate essential health information to the adult audience. So we are leveraging on our religious leaders, our religious fathers, to use their platform to disseminate this important information to our audience.
In their goodwill messages, representatives of Christian Association of Nigeria and Jama'atu Islamiyya of Nigeria also pledged to continue to preach against stigmatization against persons living with HIV and AIDS.